Good evening.
Good evening. Can I see your candidate number, please?
It's my candidate number.
299. Okay. This is your patient. You read the instruction outside, right?
Yes.
Okay, you can proceed.
Hello?
Hello?
My name is Muhammad. I'm one of the surgical doctor. May I confirm your name and age for me, please?
My name is Travis. My age is 66 years old.
Nice to meet you, Mr. Travis. How can I help you today?
I have belly pain, doctor, and it's getting worse recently.
I'm really sorry to hear that, Mr. Travis. Could you tell me more about this pain?
It's quite strange type of pain, and it's associated with bloating. I usually feel bloated. There's specific type of food that's make it worse, like dairy, for example. But it does make me uncomfortable.
Okay, Mr. Travis, when did you first notice this pain?
It was there for a long time, 2-3 years ago. But in the last couple of days, it became unbearable. That's why I came to the hospital.
Could you tell me the exact site of this pain, Mr. Travis?
It's all over my belly, doctor.
Is it present all the day or come and go?
Not all the day. It does come and go.
Can't see. Is there anything make this pain increase or decrease other than that you mentioned?
Yes. I think this pain will increase if I ate dairy food or if I ate high fiber food, and it does decrease when I eat a lot of carb. And also when I go to the toilet, I feel better.
Could you describe this pain for me, Mr. Travis? Is it sharp pain, colicky, throbbing?
It's a crampy pain. That's what I can say.
Okay, Mr. Travis, let us score this pain. If I said 1 is the lowest pain and 10 is the highest pain, how would you score this pain?
It's not severe. I can say around 5, but sometimes it get up to 8.
Did you notice any unintentional weight loss or generalized tiredness recently?
No.
Any vomiting?
No, I don't have vomiting, no.
Any acid taste in your mouth or heartburn?
I used to have heartburn, but there's no acid taste on my mouth. But for the heartburn, I usually take omeprazole, and that makes me better.
Is there any bleeding with your stool, Mr. Travis?
No bleeding with my stool, no.
Have you had a fever?
No. Recently, no.
Is there any change in your bowel habit, Mr. Travis?
Yeah, sometimes I will have constipation, sometimes I will have diarrhea. It's alternating between constipation and diarrhea.
I can see. Is this pain increased with fatty meal?
I don't know, but what I know, when I eat a lot of carbs, I feel better. When I eat a lot of fibers and dairy food, the pain will increase.
Mr. Travis, have you noticed any change in your eyes as being yellow in color?
No, I didn't.
Any change of your stool or urine?
No, there are, but except what I told you, diarrhea and sometimes constipation.
I can see. Mr. Travis, does the stress increase your pain?
Okay, that's a good question, doctor. I never thought about it. Yes, I think the pain is more when I'm stressed.
Okay, Mr. Travis, do you feel better when you open your bowel?
Yes, I feel better when I open my bowels, yes.
Did you notice any change in your skin color or redness in your eyes?
No.
Any joint pain?
No.
Have you had a trauma in your tummy, Mr. Travis?
No.
Were you diagnosed by other medical condition?
I just have diabetes.
What type of medication that you take for diabetes?
I take metformin.
Is there any history of hospitalization or surgery in your past?
Yes, I had appendectomy when I was younger. During that appendectomy, I was admitted to the hospital for 5 days, yes.
Okay, Mr. Travis, do you have family history of similar symptoms?
My granddad has colon cancer, but I'm not sure if he has the same symptoms that I have now.
I see. Do you take any regular medication rather than metformin?
No, just metformin.
Do you have any allergies?
No, I don't have allergies.
Okay, Mr. Travis. I want to ask you personal questions. Is that okay?
Yeah, that's all right, doctor.
What do you do for a living, Mr. Travis?
I'm a teacher.
Nice to hear that. Who live with you?
My wife and my youngest daughter.
Do you smoke, Mr. Travis?
Yes, I do smoke.
How many cigarettes per day?
15 cigarettes a day.
Do you drink alcohol?
No, I don't.
Now, Mr. Travis, what do you think the cause is?
I'm not sure, doctor, but I'm afraid it could be a cancer. As I told you, my grandfather had cancer. That's why I'm worried. I wish it's not a cancer.
What do you expect from us, Mr. Travis?
Diagnose and then try to figure out what's wrong and treat me, please.
Don't worry. We will take care of you. Mr. Travis, did you experience any shortness of breath or chest pain?
No.
Any difficulty of urination?
No.
Okay, I reached to our end of my questions. You have been so cooperative. Thank you so much.
My pleasure, doctor. Okay, doctor, if you can present your patient, please.
I took clinical history from this gentleman, 66 years old, diabetic on metformin. Presented with tummy pain, started 7 months and getting worse recently. The pain is in his tummy, increased by stress and dairy food. This pain not radiated to the inside and relieved by opening his bowel.
Okay, from what you're saying now, from what you're saying now, what's your most appropriate diagnosis?
My main diagnosis is irritable bowel syndrome.
Okay, what's your differential diagnosis?
Also, I will consider inflammatory bowel disease, colon cancer, gastric ulcer, also biliary colic.
How will you treat your patient if he has IBS?
First, lifestyle modification.
Okay.
As advise the patient about type of diet and exercise and avoid stress.
All right.
Then I will consider medication as antispasmodic and antidepressant.
All right.